It's okay. Now we're live.
Okay.
All right.
My name is Marnie Seebach, and I oppose Senate Bill 1146. In 2001, my older brother became addicted to marijuana in the state of Idaho, though it was not legal. He suffers from ADD, and he has claimed that marijuana helps him to focus more. It has been 18 years, and through many failed attempts, my brother is still addicted to marijuana. What started as self-medicating his ADD has turned into something far worse. He wants to be free from his addiction, but it has not come easily. In 2016, he made a New Year resolution to get off marijuana and find other avenues of becoming more focused, which turned out to be much harder than he had supposed. I was married in April 2016, and he had been off marijuana for 4 months. Through a series of events, he was put in a stressful situation, and he blew up at everyone. He was screaming at the top of his lungs, his face was red, he was completely out of control. My siblings tried to console him and stop his rage, but nothing worked. Turns out he was having withdrawals from his marijuana, and we found out that he was using it to control his anger as well as his ADD. He needed it to calm himself down and be his normal self. My fear is that people will become addicted just as with other prescription drugs, and will be seeking the high and the relief, and will ultimately be destroying their lives. I understand that my brother is more stable when he is using, but he became almost violent without using his drug. I feel that marijuana is dangerous and will damage these people more than it will help them. What seems to be the miracle drug is actually causing addictive behaviors. Additionally, the drug is not well enough regulated yet by the FDA. That's a problem because it can increase anxiety and it can actually make the seizures worse. The CBD oil used specifically for, oh my gosh, I said Siri. CBD oil and Siri just went off. I apologize. Specifically for epilepsy, has several negative side effects, and as of last year, the drug has not been tested sufficiently on children. Side effects include liver problems, negative effects on the central nervous system, gastrointestinal problems, infections, rashes, and breathing problems. In an article by Verywell Health, they explained, a study in 2017 found that nearly 70% of all CBD products sold online are incorrectly labeled and could cause some serious harm to consumers. Many of the risks are still unknown because there is only limited knowledge about the long-term effects of chronic use or about drug-to-drug interactions between CBD and other medications. Harvard Medical School explains that because it is marketed as a supplement, and not as a medication, the FDA does not regulate it, and therefore the correct dosage is still unknown, and this could cause major risks. Please consider waiting to pass this bill until further studies on CBD are done and the FDA gets involved so we know that it is safe for our children, friends, and family. Thank you.
My turn. Thank you to the members of the committee for allowing me to speak today. My name is Lisa Hupert, and I'm a licensed practical nurse. I have been working at an agency in Moscow, Idaho, that takes care of people with intellectual disabilities. These people also have, many of these have severe epileptic seizures. I'm here to ask you for your support of Senate Bill 1146. My work as a nurse and direct care aide for this agency has given me a glance into the life of these individuals with severe disorders. Life with these disorders would be helped by medical marijuana, also called medical cannabis. Senate Bill 1146 would amend existing laws to define cannabis oil and authorize it for limited use according to the language of the bill. The limited use is for people who suffer from Lennox-Gastaut syndrome and Dravet syndrome, both severe forms of epilepsy. Individuals who suffer with these seizures can suffer various types of seizures. One type is called a tonic seizure. This is where all the muscles in the body literally just stop. There's no muscle tone, and usually what happens is the person ends up on the floor. Another one is called tonic-clonic, which is also grand mal seizures. These are your convulsive seizures. They are most noticeable seizures. These seizures can also last 1 to 3 minutes, and anything over 5 minutes needs medical attention. These seizures are currently being treated with these medications: Tegretol, Lamictal, Depakote, and clonazepam. There are some serious side effects with these medications. Tegretol, like any medication warnings, has serious and sometimes fatal dermatological reactions. You can also get Stevens-Johnson syndrome. Other medications used to help these seizures are clonazepam, which is the benzodiazepine, which is also very addictive. Some of the side effects of these medications are dizziness, unsteadiness, impaired attention and memory, hyperactivity in children, and depression in adults. Side effects for the current FDA-approved Epidiolex, which is the cannabis oil used for this seizure, has fatigue, diarrhea, and constipation, and diarrhea and loss of appetite. These medications alone are not enough for these types of seizures and have serious side effects. Some facts to consider is that the FDA has studied Epidiolex and is approved it for seizure disorders. It contains no THC, which is a psychoactive ingredient found in marijuana, which is also the high effect. Epidiolex effectiveness was studied in 3 randomized, double-blind, placebo-controlled clinical trials involving 516 patients with either Lennox-Gastaut syndrome or Dravet syndrome. Epidiolex, taken along with other medications, was shown to be effective in reducing the frequency of seizures when compared with placebo. Caring for these individuals is hard for the caregivers and for their family. Both Dravet syndrome and Lennox-Gastaut syndrome have profound effects on the individuals, some having seizures up to 20 a day or more. These seizures can cause brain damage. With every seizure runs the risk of injury or death, and there is no cure. It is important to find medications that will work for these disorder. Cannabis oil and a combination of other medications can reduce activity, which will reduce injury or even death to these individuals. Quality of life with reduced seizure activity is another reason to consider passing this legislation. Please consider passing Senate Bill 1146 for these individuals and their caregivers. Thank you. Sorry, guys.
I was on mute as I was applauding. I can go next. Okay. Good afternoon. My name is Rachel Johnson. I'm a clinical psychology graduate student. I am interning within a medical hospital, specifically in the emergency department. We treat a variety of patients, and epilepsy is common within my location. I'm here today because I have investment and experience working with people diagnosed with epilepsy. Bill 1146 regarding the legalization of cannabidiol to treat epilepsy should not be passed. This bill is premature in its nature and will negatively affect communities over time, just as we have seen other prescription medications do. I am concerned there is not enough scientific evidence and medical understanding of cannabidiol, which is a non-psychoactive component found in marijuana. Cannabidiol is anticonvulsant, but has low affinity for the cannabidiol receptors CB1 as well as CB2. Therefore, the exact mechanism by which it affects seizures remains poorly understood. I do not advocate for children to be the guinea pigs to seek out this information. Prior to beginning my doctoral program, I was a chemical dependency counselor for 4 years. I have seen the hardships addiction has created for individuals and their families. Mood-altering substances have been covert in undermining one's potential countless times. Mood-altering substances decrease impulse control and decision-making, which increases vulnerabilities and risk. Cannabidiol, also known as CBD, is in the same drug classification as marijuana. Marijuana is a psychoactive substance that has gained legalization within some states and has been declassified as a Schedule I drug. However, there are still states that believe there are dangers with its use. Contrary to the rhetoric that you may have heard, CBD holds commonalities with marijuana. Despite marijuana's legalization in some states, its use remains as criteria for mental health disorders, such as substance use disorder, and has correlated with early onset of psychotic disorders, and has shown to be damaging to developing brains. Marijuana is not CBD, but they are kin. Do we really want to rush into treatments with vulnerable children? If children are prescribed CBD oils, this can impact their development, specifically the development of the brain. I'm afraid that using CBD oils may have harmful effects that we are not aware of yet. I believe the scientific community is trustworthy and diligent, but we, as the public, must be patient as they examine the long-term consequences of CBD. Until there is more scientific evidence supporting the use of CBD oil, this bill should not be passed. As a parent, I understand that you want to utilize every opportunity there is available in order to give your child the best life. Honestly, I'm excited that the scientific community has been able to determine efficacy in reducing convulsive seizures and improving the overall functioning of people with epilepsy. Specifically, randomized clinical trials, which have the clearest way to determine causation, have supported its use. But it would be a mistake to not consider the warnings as well. Long-term consequences have yet to be determined because, simply, not enough time has passed since the initial investigation of CBD oils for the use of epilepsy. Frolic states, at present, high-quality medical evidence supporting the use of CBD is modest at best. Scientific research has focused on its own use with people determined to have treatment-resistant epilepsy. This cannot be understated. Treatment-resistant, which affects 30% of patients, means that no other form of treatment has been successful in lessening their symptoms. This law does not differentiate this critical difference. We are leaving this determination in the doctor's hands. Let's continue to allow the scientific community to shed further light on CBD's effects and determine whom CBD treatment is most appropriate for. The bill, as it stands, will allow CBD to be the forefront of treatment. Our kids deserve more thoughtfulness and care than this bill allows. Does anybody have questions?
All right. Okay. Members of the committee, my name is Kim Mizia, and I'm a graduate student in the School of Social Work at Boise State University, a member of the International Dravet Syndrome Epilepsy Action League, and most importantly, a proud mother to a very special little girl that has been diagnosed with Dravet syndrome. Pursuing a master's level degree in social work is a direct result of my desire to advocate not only for my child's unique medical needs, but also to advocate for children throughout the state of Idaho. Today, I ask for your support of Idaho Senate Bill 1146, Alexis's Law, a bill that would change the lives of many Idaho children living with this and other similar seizure conditions by defining cannabidiol and authorizing its use in limited circumstances. Dravet syndrome is a rare and lifelong form of epilepsy that has no cure, has limited treatment options, and can lead to sudden death. As is the case with my daughter, children diagnosed with Dravet can have several hundreds of seizures daily, which severely limit their ability to participate in daily life and ultimately diminish their quality of life. For my family, this means monitoring our daughter's every waking and sleeping moment to ensure that she remains breathing in spite of epileptic activity. Since there is no cure for Dravet, families like mine, Alexis carries, and many of the others you've heard from throughout this hearing endure countless trials of epilepsy drugs to try to gain some control of the seizure activity. Unfortunately, this often leads to creating a drug cocktail that in many cases simply does not work or has countless side effects. Across the country in states that have legalized the use of cannabis treatments in the form of CBD oil, families impacted by Dravet syndrome have seen tremendous success in completely eliminating or greatly reducing the amount and severity of seizures. These success rates have been backed by scientific research, including a study done by GW Pharmaceuticals, which was published in the New England Journal of Medicine in 2017. Results from this study and other similar research show that CBD effectively reduces the frequency of seizure activity in some cases. Opponents of this legislation will try to persuade you that a cannabis-based treatment is immoral and that we should not expose our children to a psychoactive drug that has short and long-term cognitive effects. However, this argument falls short when it comes to CBD. There are two primary cannabinoids that occur naturally in the cannabis plant, which are THC and CBD. Unlike THC, CBD is a non-psychoactive drug, meaning it will not make the user experience a high as THC will. CBD has many medical benefits and offers a natural and safe remedy that holds the potential to replace psychoactive pharmaceutical drugs that are currently used in attempts to control Dravet seizure activity. Thank you for your time and for hearing my concerns and personal experiences as they closely relate to Alexis's law. I urge you to support this piece of legislation and give freedom to the many children and families that are impacted by the devastating consequences of Dravet syndrome in the state of Idaho. Thank you.
Ooh.